how to cope with PCOS. Welcome to Fertile Minds. My name is Robert Lahoud. I'm a fertility specialist and reproductive endocrinologist, and I work as the clinical director at the IVF Australia North Shore Clinic. How to cope with PCOS on a day-to-day basis. First of all, there are several symptoms that are associated with PCOS. One of them may be excessive facial and body hair. This is called hirsutism, and these symptoms obviously can be quite difficult to manage. In the short term, we recommend cosmetic treatments such as electrolysis and laser. Long-term hormonal preparations such as the combined oral contraceptive pill and anti-androgens such as spironolactone and cyproterone acetate are very good options at managing this condition. You do need to see a specialist or your GP about this to get these medications prescribed. With regard to acne, which is also very common, we often use very similar treatments. There are obviously topical treatments like face washes that can be effective. You can take topical antibiotics from time to time. And then you've got the hormonal preparations that I mentioned before, such as the combined oral contraceptive pills and the anti-androgens that help to manage that condition over time. And if the acne is very, very bad, especially cystic acne, then it's good to maybe see a dermatologist who might recommend the use of Roaccutane, which is very effective. Important to say that while people are on Roaccutane, they're not allowed to fall pregnant because it is teratogenic, so it's really important to have some form of contraception at the time. In regards to irregular periods, these are very common in patients with PCOS, and they're related to irregular or absent ovulation. And these can sometimes be very heavy and painful and unpredictable, which makes life very difficult. Often we use hormonal treatments like the combined oral contraceptive pill to change this. And this is really important because it can also reduce the long-term risk of cancer of the uterus, which is slightly increased in women with irregular periods. So this is, again, you probably need to see your specialist or GP about this to have this treatment started. With regard to weight gain can be part of polycystic ovary syndrome. And there are many reasons for why people gain weight. It doesn't always just have to be the PCOS. But certainly, if you have PCOS, there are certain strategies that we try to use to help to lose the weight and look to just be really fit, which is what I always talk to about my patients. So to be fit, you should exercise a bit and generally be very healthy with your diet. So healthy choices, regular meals is often what we recommend. There are some medications that could be also used to help with weight management. But look, I think the most important thing is not to target the weight, but to look at a healthy lifestyle. At the end of the day, if you live healthy and your weight is a certain weight, then you probably are healthy, even though the weight might not be exactly what everyone would like you to be. And that's a much more achievable goal. So whatever we do, it's got to be sustainable and achievable. And so a healthy lifestyle, if you follow that's really the best way to manage PCOS and your weight. So with regard to emotional implications, the symptoms of hirsutism, acne, and the irregular periods and sometimes the decreased fertility can be emotionally difficult to handle. And so it's really important to seek support. That support can be by finding good sources of education about PCOS, by speaking to your doctor, seeking help from a psychologist too. So all these things can really help to get you through this. It's always important to remember, as you understand your condition and you manage it, everything can be overcome and we can manage the symptoms and really help you with whatever we need to help you with. So with regard to long-term health implications, there are two main ones. One is there's a higher risk of diabetes in women who have PCOS. And this is particularly increased in women who are overweight and obese. So lifestyle with a good diet and exercise regime is really, really important. Medications such as metformin can be used as they lower insulin and make the onset of diabetes less and delay it, which is a really important thing. The Other treatments for diabetes obviously would be more handled by an endocrinologist, such as the use of insulin if that was required in the future. But in the short term, a good lifestyle with potentially the use of metformin is what we commonly recommend. With regard to the other long-term health implication, that is a higher risk of getting endometrial cancer or cancer of the uterus, which is increased in women with irregular menstrual cycles. In that case, often we recommend the long-term use of the combined oral contraceptive pill to regulate the hormones and the effect on the uterus. So with regard to conceiving, if you have PCOS, there are several treatments. So from a hormonal point of view, the number one treatment now is called letrozole. It's a simpler tablet where patients take 5 tablets of this letrozole in the beginning of their menstrual cycle. And as a result, about 75% of women start to ovulate very regularly, and the pregnancy rates are really good. And a lot of women do conceive with this treatment. If this is not effective, then we do have other medications. One is a drug called Clomid or clomiphene citrate, which we sometimes use if the letrozole doesn't work. It's a slightly older medication. It's the one we used to use, but it's something we can still find useful in some patients. And then there are more advanced treatments like injections with a hormone called FSH or follicle stimulating hormone that is very effective. If you use that, you nearly get 100% chance of ovulation. These drugs are much more difficult to administer because they're injections. Furthermore, we need to monitor the progress very carefully because they're associated with a high number of multiple pregnancies if you don't watch. So we watch these patients in our clinic with regular blood tests and ultrasound, really careful that they don't produce too many eggs or follicles to keep the number of multiple pregnancies down. And IVF is an alternative treatment, which is really a second-line treatment if the other treatments have not worked. And with IVF, we stimulate the ovaries to make lots of eggs. We harvest those eggs with an ultrasound-based procedure, make them into embryos, and the chances of this working for women with PCOS is generally very, very good. We only use this if it's needed, and really we would aim for more natural therapies, even some simple medications first in the hope that that's successful. If you've been diagnosed with PCOS in the past and you've used the combined oral contraceptive pill for some time, your symptoms that you had originally are being masked by the oral contraceptive pill. Now, when you come off the pill to maybe fall pregnant or because you want to have a break, it's really important to see, and because your symptoms might be different now from what they were before, and your periods that used to be irregular could be quite regular. And from a fertility point of view, it may mean that you're actually quite fertile at that stage. So it's really important to understand that things are not always the same and they can actually improve over time. So normally what I would do is stop the pill, wait for 2 or 3 months to see how things go, keep a record of it, and if it's still irregular periods or the skin gets bad, then definitely seek medical help. Thanks for watching Fertile Minds, and don't forget to subscribe.